Hello, 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 and good morning to you. Good afternoon, good evening, whenever you are catching this live and or on the replay. My name is Michelle Mickey Jones, and I am a 20-year lupus survivor. And during this May month of lupus, I am coming to you with the tips and tools and resources that a survivor, a caregiver, a family member, a friend, a supporter would normally ask or would like to ask and not know how to ask about how to care for or support a survivor. Now, again, my name is Michelle Mickey Jones, and today we're going to talk about water intake. One of the questions that I often get is whether or not drinking a whole lot of water, because I run and I drink an awful lot of water, and when I run I drink more water, whether or not drinking water actually increases the inflammation. So the question is, how can drinking all that water really help you? Well, it's a twofold process. It may be three. One of them I sort of like meld into the other. Well, one, water is a hydration method. Because water is a hydration method, your body absorbs it and it expels it normally, because you drink a lot of water and you go to the bathroom a lot, and it actually filters through your system, and it draws out the toxins with it. Inflammation in itself, the swelling that you get in your hands and your feet and in your knees, is based on toxins in your body, the level of toxins in your body. So remember, lupus fights the good cells, the good viruses in your body. It fights within itself. It fights the good things, so it leaves the bad stuff. So water actually filters those out. Not all of them, but those that are in your bloodstream and in your kidneys. And it filtrates through your intestines. Now, this is a quick question for you. Have you ever gone to the doctor and your phlebotomist, your lab tech, is trying to take your blood and they just can't quite get the vein to stay active and to flow, and your blood flows slowly through your vein? They stick the tube in there and it just ain't shooting straight out. And they'll ask you, have you been drinking water? Because water, again, is a filtration method, and it filters through your body, so that means it constantly keeps your blood flowing free and fully oxygenated. Okay, so that's one thing that water does for you, especially when you are fighting the inflammation. It clears out the toxins in your body and it hydrates you. Another thing that water does for you is it clears your skin, and it keeps your joints moisturized, and that's the best way that I can say it. So with lupus, you suffer a lot of inflammation from having achy joints and swollen joints. So when you're drinking water, your muscles are being hydrated, your fluid is flowing. Everything about your body is a flowing process. So anything that you can do to increase the flow of oxygen through your bloodstream and through your body is a help. And water is an energy conduit, so it flows through your body and it helps you. It takes away those achy joints, because that's just either bone rubbing against bone or swollen muscle tissue, because it's trying to rehydrate itself. The swollen muscle or the dehydrated muscle is trying to draw from your body what's not there. Because if you're not drinking water, the elasticity isn't there. So when your muscles get tight and swollen, it's looking for some oxygen, and it pulls it from the water, the fluid in your body. So instead of pulling it from your oh my gosh, I can't think of the right word for the muscle fluid. I have to look that up. I'll put it in the comments. But there's a fluid that is created in your body naturally that hydrates your muscles. And when you don't have enough hydration, your muscles swell and it pulls what's left in your body. So if you are hydrating your body with water, I'm not talking juice. I'm not talking seltzer. I'm not talking Propel or any of your flavored waters. I'm talking pure H2O. Spring water, filtrated water, city tap water, whatever. If you are hydrating your body with water, you reduce the inflammation in your body because your body is now filtrating and it is flowing out all of the toxins. And then it kills infection as well. Now, this is real. Now, I talk real talk. So most women suffer with UTIs and yeast infections. And the majority of those women are not drinking enough water to filter those toxins out of their body. Once you begin to drink water, you will notice a color change in your urine stream. It will go from this dark yellow, which is usually full of toxins, to almost a clear color with just a hint of yellow in it. That's good. That's not bad. That is good. That means that the toxins are coming out of your body and you are filtering and creating an energy in your body. Now, this is just an absolute side note. Statistically speaking, from a health-wise point of view, it is recommended that you drink at least a gallon of water a day. A nutritionist will tell you that you need to drink half your body weight in water per day. That's healthy. So whichever one you like is good with me. So if you don't have, if you're not 64 ounces is to 100. If you're not 125 pounds and you drink a gallon of water, you're still good. If you are 210 pounds and you drink a gallon of water, you are still good. But it would help you if you drank 100 gallons of water. You understand what I mean? Because your body will be energized by the amount of water you take into your body. And again, the first thing is it cuts down on the toxins in your body and it reduces your inflammation. It doesn't increase it, it reduces your inflammation. The second thing is it hydrates your complete system. It hydrates your muscles and it hydrates your bones. A lot of people that suffer with lupus also have low bone density. So the water that you put into your body, along with the other things that are healthy for you, actually keeps your bones from being brittle. Think of a leaf. If you take a leaf from a tree, it's fully in season, it's nice and it's green and it has all the little red veins running through it and it's just prosperous and growing. And you do not give it any more water. What does it do? It dries up and becomes brittle. It breaks into small pieces and it blows away. Same difference when it comes to your bone density. If you do not hydrate your body, if you do not keep it moisturized, your bones will become brittle and they will start to deteriorate. And again, this is how we get into arthritis. This is how we get into arthritis, because not only is your bone deteriorating, but the cartilage and the muscle that surrounds it, and most of it happens in your knees, it begins to go away. Your body has sucked all of the moisture out of the cartilage. That was the word I was looking for earlier. Out of the cartilage and the muscle, so there's nothing left to protect the bone. So now your body is drawing out the water that is in the bone. And if there isn't any in the bone, it becomes like that leaf and it dries out, becomes brittle, and breaks away. Okay, so these are just some need to know facts that most people don't discuss. So when you go to the doctor and you are in the process of being evaluated for possible lupus, or you are going to the doctor because of lupus, make sure you talk about your bone density, your oxygenation, and your water intake. Those are all important elements in your plan of care. And guess what? This is not just for the lupus sufferer. It is more increased for the lupus sufferer as far as arthritis is concerned, bone density deterioration, Porosis, all of that plays into your lupus diagnosis. So be careful to make sure that you are oxygenating your body with enough water throughout your day, every day, all day. And if it takes you all day to drink a gallon of water, drink that gallon of water. Drink it in increments. They'll tell you 8 ounces at a time. Fine. If you don't like water and you have to drink water, make it 4 ounces, as long as you get it in your body within a 24-hour period. And we know that most of us are not up for a straight 24 hours, so let's knock that down to 16 hours and get that water into your system. Okay? So this is Michelle Mickey Jones, or should I say I am Michelle Mickey Jones. I am a 20-year lupus survivor, and I am coming to you today to just talk to you about your water intake and how it helps in your lupus plan of care. Have a great day.